Hello, viewers, and a very warm welcome. You're watching The Big Picture with your host, Kriti Mishra. COVID-19 cases have declined in cities, but district-level data shows a surge in small towns and rural areas. In 13 out of the 24 states where districts can be split into rural and urban areas, there are more cases in villages and small towns than in big cities. In the other 11 states, cases are growing faster in rural areas. For example, data from Maharashtra shows how the COVID wave has shifted to rural areas. The state averaged roughly 54,000 cases on both April 9th and May 9th. But while rural areas had only 32% of the cases on April 9th, a month later, their share increased to 56%. In UP, rural areas now have 65% of the cases, and in Chhattisgarh, their share is 89%. In Karnataka, where cities still have more cases, the share of rural areas has risen from 25% to 44% over a month. So, how do we tackle this surge in rural India? Let's find out from our distinguished guests. Joining me on the program today, Dr. Suryakant, Brand Ambassador, COVID Vaccination, NHM, Uttar Pradesh, and Dr. Ravi Kirti, Additional Professor and Head, Department of General Medicine, AIIMS, Patna. Welcome to Rajya Sabha Television, both of you.
Thank you.
And Dr. Khan, coming to you first, what is your understanding of the scale and speed of the spread of COVID-19 in rural parts of the country, and of course in Uttar Pradesh as well?
Okay, I will start with the National Health Policy Report 2017. If you just go through the report, and of course its health indices, and a short comment that in Uttar Pradesh and in Bihar and other states, the infrastructure of health is very poor in the rural areas. It is very strong at the district level, while it is very poor at the rural areas. And they have recommended the spoke and hub model. Probably this is the best model which we can use for any health ailment, for any disaster, for any endemic or pandemic disease. But till date, this has not been developed. So what can we do? You see, in rural areas, the problem is that people, they are not aware of the symptoms of COVID-19, which are entirely different in the second wave. In the 2020, we used to say that high-grade fever, dry cough, and shortness of breath are the three classical symptoms of the COVID-19, along with vomiting, diarrhea, and loss of taste and loss of smell, which were in a small proportion of cases. But in second wave, my dear friends, there is no peculiar symptom of COVID-19. Rather, I would say every new symptom to be considered as COVID due to COVID-19 until proved otherwise. So this message has to be, of course, the day you are feeling unwell, मुझे कुछ ठीक नहीं लग रहा है, the day you should understand that you are suffering from COVID-19. Not today. You got infection 5 days back, because incubation period of the COVID-19 is on an average 5 days, ranging from 2 to 14 days, but on an average 5 days. This means if you are having first day fever, first day dry cough, first day headache, first day body ache, whatever the symptom, आंख में खुजली हो तो कोरोना, सिर में दर्द हो तो कोरोना, गले में खराश हो तो कोरोना, सीने में दर्द हो तो कोरोना, पीठ में दर्द हो तो कोरोना, बॉडी एक हो रहा तो कोरोना, लूज मोशन तो कोरोना, लॉस ऑफ टेस्ट तो कोरोना, लॉस ऑफ स्मेल तो कोरोना. So every symptom is now corona, number one. And once you develop symptom, the very first day you should consider that you got infection 5 days ahead, 5 days prior. So disease is already gone 5 days. And the people who are advocating that this is the replication phase. No, this is not the replication phase. You see, it has manifested fully, I would say. That's why symptom came. So in rural area, मेरी एक छोटी कहावत है हिंदी में, न जांच न रिपोर्ट, करो कोरोना पर सीधी चोट. What is that? Because if you are getting tested, the report will come in how many days? At least 5-7 days. Then whatever the fate, it will happen. Nobody can save you. So my suggestion is that we should follow the Goa. Goa has taken the lead. The Goa have started 5 days ivermectin prophylaxis program. And I think the whole of the country, now the Indian Council of Medical Research, whatever the National Task Force members, I'm not the member of National Task Force, this COVID, But whosoever, including health minister, if he's watching this or he can watch this, I will appeal him, Dr. Harshvardhan, because he's a doctor also. He's an ENT specialist. That please provide the ivermectin prophylaxis like Goa state to all our rural state, at least in top 13, 14 states. That is my one suggestion. Dr. Surikant from King George Medical University, Lucknow. And I am having the 1100 COVID bedded hospital, largest probably COVID hospital in the India. And we are having a lot of experience, not only treating the urban people, but semi-urban and rural too. And we are closely linked with the rural population. I have already appealed to the rural population at least 4 weeks back that be aware, because Panchayat Chanav was going on here and we were afraid that yes, now it will spread into the rural areas, and my prediction, my apprehension came true. It happened. The second thing is that what are the wonder of drugs which can save the life? Only two drugs. Yes, oxygen is also a drug. Don't consider it a simple gas. It's not a gas, my dear friend. It's a gas. It's a drug. Two drug only saving the life. One is oxygen. Second is steroid. Now, many of people, they advocate don't use early steroid. But my dear friend, when the oxygen is going below 94, it is not early COVID. When the lung has been involved by COVID disease process at least for 40%. When the 40% of the lung this has been involved by COVID pneumonia, then your oxygen level is going below 94. So this is not early COVID. Don't stop me to advocating the use of steroid. Please, for the God's sake, we have to save our rural people. And when the oxygen level goes 94%, use ivermectin, doxycycline, and prednisolone or any steroid. This is triple drug combination which will save our lives of the rural people. Nobody can.
Absolutely.
We cannot develop the infrastructure. We cannot develop the facility of testing. We cannot develop the facility of all these parameters, inflammatory markers, D-dimer, whatever it is. They are not available in the rural areas. So believe me, of the experienced doctors, the clinical skill. And of course, so these are my two suggestions, that do ivermectin prophylaxis for everybody in the rural area and treat those who's having oxygen level below 94. They should be given triple drug combination, the ivermectin, doxycycline, and prednisolone. This is my recommendation.
All right, Dr. Kant. All right, so that's the submission that you're making. Also on our show, we've been telling people that we have to rely on the medical advice as far as the consumption of drugs that is concerned. But talking about rural India and coming to you, Dr. Ravi Kirti, hotspots are now emerging in rural spaces in some of the poorest parts of the country. So how do we create awareness in the peri-urban, rural areas and tribal areas by involving the field level functionaries like Anganwadi workers, ASHA workers, ANMs and others, so that there is no panic regarding the initial symptoms of COVID pandemic?
So it's hardly surprising that we are now seeing a surge of COVID infection in tier 2 cities, district towns, and the rural areas. First time during the first wave, we were largely able to avert this crisis, probably because of very early lockdown and other measures that were there. And during the first wave, the urban population by and large was sensitized to all the preventive measures that we can take, including the use of masks and social distancing. And these are our two most important weapons in the fight against this disease. We didn't see that kind of awareness in the rural areas last time around, but this time it is imperative that we have to create that awareness, because we know that the virus has reached the hinterlands of our country, and it's very much there in small suburban places, rural areas, etc. We also know that cities do not exist in isolation economically, culturally, socially. There is so much give and take between cities and the surrounding rural areas. So it's important that we use whatever infrastructure we have available in our villages. And as rightly pointed out by yourself, that includes our PHCs, our CHCs, our ANMs, Anganwadi workers, ASHA, healthcare workers, etc. And all of them by this time have been not only sensitized but trained in creating awareness about the preventive measures that we can take. And we just need to rely on these people and ensure that the rural community by and large is involved in this exercise, because at the end of the day, unless there is involvement from the public, it's not going to be successful. Secondly, we also need to make sure that for the very sake of training, we do not gather crowds, because those itself could become super spreader events. So we can use all the electronic media. We can use pamphlets. We can even have these healthcare workers and Anganwadi and Asha workers going from house to house and speaking to people from a distance, and trying to impress upon them the need to maintain social distancing and the use of masks whenever they are outside their homes. One good thing about this infection is that the risk is not so much in outdoor environments as in indoor environments. So, for example, when we have our farmers and laborers working in agricultural fields, for example, when people are not necessarily in very close proximity with each other, they don't need to wear masks. But if they are gathered in places like mandis, etc., where they have to go for economic reasons, it's very important that number one, they wear masks, and number two, we are able to exercise self-discipline and try and keep away from crowds, because these are the two most important things: avoiding crowding and the use of masks, which will eventually help us to break this chain of infections. And before I finish, whenever I talk about masks, I always make sure that I impress upon people the need to use masks effectively, which means that our mouth and our nostrils must be covered. If it's just covering our chin, that's no use.
True. Absolutely. We have to follow COVID appropriate behavior at all times. But Dr. Kant, you were making a very important point about testing in the rural areas. Now, as you said, that RT-PCR test considered as the gold standard of testing for COVID-19, that may be little difficult in the rural areas, though not impossible. So how do we make a complete or a robust process of testing, tracing, and isolating?
Yeah, and door-to-door campaigns should be started, because if you are saying, if Pradhan is saying, village Pradhan saying, then come forward and have a pulse oximeter testing. You see, do you think that ladies will come to the Pradhan's house for testing? No. So it is the door-to-door campaign which has to be done, and with a register that how many members you are having in this house, and please sanitize the machine, sanitize the finger, and do, of course, do the morning, evening oxygen level, at least in symptomatics.
Right.
That is how you can monitor the whole village, and that is how you can save the whole village. And just make a packet of, I said, 3 drug therapy. Fourth is the paracetamol. Paracetamol is easily available even in the medical store of a village. Everybody knows paracetamol. Ki fever aaya to paracetamol. And even if paracetamol is not available and person is having fever, simple way is cold sponging. I know that fridge is not available in the village, but surahi is available, ghada is available. And if nothing is available, then hand pump is available. So take out the water from hand pump. It's a very cold water. And of course, do the cold sponging. It's not the cold, of course, strip here. No, the cold sponging of the whole body. Within 15 minutes of cold sponging, the fever will come down. Why do we want fever come down? Because in fever, there's a lot of metabolic activity, lot of water loss, and patient will go into dehydration. He will not die because of the COVID-19. He will die because of dehydration. And we should not allow us to do this, to do this happen. So a lot of plenty of fluids. So in the village, what is you are having? Lemon is you are having in the village. So just 1 glass of water, lemon, a little bit salt, and a little bit sugar, and that will make a drink. That is called the sharbat, or this is called, I just forget what is the name.
Yes, sir. Water we can have. That's what you're trying.
Chicken. This is called shikandi. Yeah, nibu ki shikandi. So a plenty of Nibu ki shikanji, matta plenty is available in the village. So such kind of food, they should be supplemented. You see, I don't want to waste the money of the villagers in the vitamins. Villagers have a lot of vitamins. Why are vitamins not working directly on the virus? That is the hard time to hit the virus. And you cannot raise the immunity over the night. It takes time, it takes months. So there is a sheer wastage of the money if you are providing vitamin B, C, D, zinc, and all blah blah, which in urban people we are prescribing. Yes, I'm also prescribing to the urban people because they require, they can afford. Yes, government is supplying here, but basic minimum we require paracetamol and triple trick combination. This is my humble request to all those matters in this country that please do it. Otherwise, we will not be able to save our villager people.
Dr. Ravi Kirti, do you agree with him since we have limited availability of specialist doctors in the rural areas?
Well, the good thing is that majority of patients only have mild disease, and so they can actually be managed at the village level. So there are two things. One is the testing aspect, and the other one is the management aspect. So a rapid antigen test, as rightly pointed out, has low sensitivity, which means that it will give a lot of false negative results also, meaning people who have the infection will be missed. Nonetheless, we have to make the best use of whatever resources we have with us. And the good thing is that rapid antigen can be used anywhere and people can be trained to use it. And now we have a large number of healthcare workers and other people in this country who have been trained to use these kits. So anyone who has symptoms suggestive of COVID-19, if a rapid antigen testing facility is available, they should be tested by this. If it is positive, if the result is positive, then this has to be taken as COVID. There's no further need for RT-PCR testing because even though there can be false negatives, there won't be many false positives. In other words, the test is still very specific, even though it is not very sensitive. Now, for those people who have symptoms of COVID-19, where there is a clinical suspicion that they are suffering from this infection, if they test negative, then considering the fact that this test has low sensitivity, they should be further tested with an RT-PCR test. Now, as rightly pointed out, our ability to do RT-PCR tests is limited, and so there can be a delay before we get the reports. So what to do in the meanwhile? So yes, I agree that in the meanwhile, if they have symptoms of COVID-19, then they should be treated as COVID-19. And not only that, the other family members and people around them should be protected. In other words, that person should go into isolation even while we are waiting for a confirmation by RT-PCR. And thirdly, so we have testing, we have the need to isolate them to protect other people around them. Then, of course, we should start whatever treatment is needed even while we are waiting for the results. And number 4, monitoring is very important. And the single most important method or measure of monitoring is the pulse oximeter, whereby we can monitor their oxygen saturation. And we expect the oxygen saturation in a person with healthy lungs to be in the high 90s. So usually we say that if it's above 95%, then we are still dealing with mild disease. But if it's less than 95, then those people should they deserve to have greater level of medical attention, and they might require oxygen and other treatments like steroids, etc.
Absolutely. But there's another important aspect that I'd like to touch upon, which is vaccination. Dr. Kant, vaccines offer the best exit strategy from the pandemic. Taking vaccination to rural India is a complex task, probably. How do we achieve it with decentralized planning and a community-based approach? Because we may see resistance.
Yes. Actually, vaccination is a very experienced domain of India. But I don't know why we are having only 20-25 lakhs vaccination per day. If with this pace we are going to vaccinate India and we want to achieve a target of 90 crore people, that is the target of getting the herd immunity in this country. So we will have to vaccinate 180 crore doses of vaccine. Until date, only 17 crore doses they have been given. So target is far ahead. And with this pace, we will take 4 years to come. And if this happens, my prediction is we will not all have only third wave, we will have fourth, fifth, sixth, seventh, eighth, ninth, 10th waves. If this pace of vaccination is going on. So my request is India has the capacity. Yes, we have the capacity of vaccination, 1 crore people per day. And if you vaccinate 1 crore people per day, we will finish the vaccination target within 6 months, means 180 days, because we will vaccinate 180 crore doses within 180 days. That is comes to be 6 months. So we can finish this work 6 10, and even third wave will not come. That is my guarantee. If you want to have it written on a stamp paper, I can give you on a stamp paper. Yes, that is my guarantee. So you have to increase the pace of the vaccination. And without rural India, you can do it. 65% of Indians, they are living in rural area. Why don't you think this? Oh, you see, and the second objection is very strong objection I have, that the hospital facilities where COVID treatment is going on, a lot of institutional COVID load is there. Yes, people talking of viral load in the individual. I'm talking of the viral load at hospitals. If a hospital, suppose my King George Medical University having 1,100 COVID beds, can you imagine the viral load? I'm living in the sea of viruses. I'm fortunate that still I'm negative. Dr. Surikant, probably one of the rarest species in this country that even working in this field, in this environment, I'm still negative. I have been sent to the Agra when Agra problem was there in last year. A lot of rampant cases in Meerut. I was sent in Meerut. So I never feared. I never, you have any apprehension or any hesitation in my mind to go anywhere. Wherever the cases are rampant, government sent me and I went there. But I would say that in the villages, yes, you can use the primary school for vaccination. Any community center in the, of course, the mid-urban type of kasbas, tahsil block. There are a lot of tahsil buildings. They are block buildings. I mean, they can be utilized and you have to do vaccination camp. The whole team from the district that can go, of course, on the due date. And of course, the villagers should know that the team will come and you vaccinate all 18 above on that day. Finish on the same day. No app, no registration. Only thing is you want data. Why would you want app and app every time you are complicating the procedure? I'm deadly against this procedure. How villages will do? You are allowing 4 people on a single mobile number registration. From where this smartphone will come in the village? No, there are not. And the people don't know how to download the app, how to do registration. So a lot of people in the city also don't know. But anyway, so don't complicate the procedure. Don't follow the Western world. We are different world. If you want to do practice of any health ailment, any healthcare system, you should know the India. You should know the Indians. Our system is entirely different. WHO cannot understand our system. America cannot understand our system. We have to understand our system. And we are understanding our system. But problem is this. So for all 3 strata, we have to work together. For those who are income taxpayer, 7 crore people, make it free. Free in the sense means chargeable, fully chargeable, and they should are authorized to directly communicate to the Moderna and Pfizer. They should brought the vaccine and they should vaccinate it. Number 1. For the middle income group people, yes, you can provide the government facility, but for the rural population, you have to assist them, you have to provide free of cost, and you have to facilitate them by this system which I proposed.
Absolutely. So we've been saying that vaccinate, vaccinate, vaccinate. That is the strategy. But before we end this conversation, Dr. Ravi Kirti, now that experts are saying that a third wave of the pandemic is possible in the coming months, going forward, what do you think could be India's approach to the crisis?
Well, we should learn from our experiences and be sure that we don't declare victory too soon this time. So once this current peak subsides, we have to make the best of that small duration that we might get before the third wave to ensure that we vaccinate as many people as we can, because that is our only hope to end this pandemic, number one. And number two, of course, we should continue with all the measures to prevent transmission, which includes social distancing and the use of masks, because that will prolong this period before the third wave, and so we will have more time to vaccinate ourselves. Because last time what happened was, after the first wave was over, all of us felt that no, that's the end of the pandemic, and we started all sorts of social activities, and people started having parties, etc. So we don't have to repeat those mistakes this time. We should be careful for the foreseeable future and continue with all the preventive measures. That will give us a little more time to vaccinate ourselves. And as rightly pointed out, we have to do everything possible under the sun to get as many people vaccinated as possible.
Absolutely. So it is the responsibility and the onus is on all of us to follow the COVID appropriate behavior. On that note, thank you so much for joining us.